Hey everyone, and welcome. Today we're jumping into a topic that is just so incredibly important for keeping our patients safe. We are going to master the nutrition score of the Braden Scale. So let's get right to it. We've all got it drilled into our heads. Turn and reposition. It's like rule number one of patient care, right? But what if I told you that even if you have the most perfect clockwork-like repositioning schedule, it could all fall apart if you're missing one critical piece of the puzzle? And right there, that's it. This is the big idea we're digging into today. You can be doing everything perfectly on the outside, but the real fight for skin integrity, that's often won or lost from the inside out. If a patient's nutrition is poor, it just completely undermines all that hard work. Okay, so when we're looking at the Braden Scale and it asks us to score nutrition, what is it actually asking us to do? I'll tell you, it's about way more than just glancing at a meal tray and seeing what's left over. So here's the official definition from the guide. It's all about evaluating the patient's usual food intake pattern. And that word usual is so important. We're not looking at a single meal in isolation. We're looking for a consistent pattern over time. So that intake pattern really breaks down into four concrete things we need to look at. We're assessing their protein intake for tissue repair, if they're getting enough calories for energy, their actual physical ability to eat, and of course any special support they might be on like tube feeds. Let's really zero in on what I think is the most important factor here for tissue health: protein. Seriously, think of protein as the actual bricks and mortar for the body. You need it for collagen, for healthy immune system, all the good stuff. Without enough protein, the body just can't build or repair tissue. It's that simple. It leaves the skin incredibly vulnerable. And when that healing potential is just not there, well, the consequences are pretty severe. You start seeing wounds that just refuse to heal, tissue that can't handle even a little bit of pressure, and of course, a much, much higher risk of new skin breakdown. The stakes really couldn't be higher.
If you boil it all down, it comes down to this simple, powerful equation. Malnutrition leads directly to decreased tissue integrity. It's a straight line, a cause and effect relationship that we as clinicians have to spot and interrupt to protect our patients.
Okay, so that's the why. Now, how do we actually measure this at the bedside? Well, the Braden Scale gives us a really nice, clear 4-point system. It's our framework for assessment. Let's break it down score by score. All right, here's our roadmap. A score of 1, that's very poor, is for a patient who has a severe deficit. They're never finishing a meal. Maybe they're NPO or on clear liquids for over 5 days. Then you have a 2, probably inadequate. This is your patient who's got insufficient intake, rarely eats a complete meal, maybe gets about half of what's offered. Moving up, a 3 is adequate. This patient is doing better, eating more than half of most meals, and their intake is generally meeting their needs, maybe with a little help from a supplement. And the top score, a 4, is excellent. Optimal intake, they're eating almost everything, no deficiencies in sight. Okay, now we need to talk about something that causes a ton of confusion and can lead to some big scoring mistakes. What do we do with our patients who are on tube feeds or TPN? So here's the common misconception. A lot of people think if a patient has a feeding tube or is on TPN, they automatically get a low score, like a 1 or a 2. But that's just not right. The clinical reality is that you have to assess the adequacy of that support. Is the formula or solution they're getting actually meeting their specific calorie and protein needs? That's the real question. So the key takeaway here, the thing to burn into your memory, is this: the route does not equal adequacy. Just because it's coming through a tube doesn't mean it's inadequate. A patient on a well-managed, high-protein tube feed could absolutely be a 3 or even a 4. It's all about whether their needs are being met, not how they're being met. So to help you put all of this into action, I want to give you a super simple 3-question checklist you can run through right at the bedside. This is going to make your scoring way more accurate and consistent. So before you circle that number, just ask yourself these 3 things. 1, is their protein intake sufficient? That should always be your first thought. 2, are they eating more than 50% of most meals? This is the big dividing line between a 2 and a 3. And 3, do they need supplements to meet their goals? This can help you feel really confident in that adequate score. Okay, let's pull this all together for the big picture. Scoring nutrition accurately, it isn't just about checking a box or getting the paperwork right. It's about fundamentally changing our patients' outcomes for the better. And this really gets to the heart of it all. We tend to think of prevention as all the external stuff, the special mattresses, the turning schedules, the barrier creams. But true foundational prevention, it starts deep inside, at the cellular level. And that is fueled entirely by nutrition. Getting the score right means we can intervene early, and that is prevention at its most powerful. So, what can you do with this information right now? First, save this guide. Keep it handy for your next shift. Second, take a minute to review your own facility's breeding policy. Make sure your practice lines up. And maybe, most importantly, share this with a coworker. The more of us who get this right, the safer our patients will be.
And I'll leave you with this final thought. Now that you have this clarity on nutrition scoring, how are you going to approach your next patient assessment a little differently? How will you use this to improve patient care on your very next shift? Thanks so much for joining this explainer.